Today, we are going to be discussing whether or not to get an epidural. So really the main thing to know is to do your own research, to know your options, get educated, and to know yourself, and to be confident in what you want your labor to look like, what you want your labor experience to be like. Everybody's different. It's important also to be flexible. You could go into labor, having one train of thought, and then one thing leads to another. Maybe it's not going to go that way, right? So know yourself, get educated, but also be flexible. It's important to know that if you cannot manage your labor pain, it's okay to get help. We do not want to shame or guilt women about what they want for their labor. You get to make that choice for your body, for yourself. I will discuss some pros and cons of natural versus epidural. So with natural birth, there is decreased postpartum mood disorders. You will have much easier movement during labor and delivery as far as stretching and positions. Movement is very good for labor, so you may have a faster labor because you're able to move. You will have a faster recovery and less side effects when there's no medication given. There's also fewer C-sections and fewer interventions. Some women have an increase in positive birth experience as far as feeling empowered, feeling in control, feeling in charge of their body. Also, your baby may be more alert after birth. The cons for natural birth, I would say that, some women experience high levels of pain. And everybody has a different levels of pain tolerances. So if you want a natural birth, it will require you to know coping skills, to have them practiced beforehand. And it will be much better to have a support person. You will want a consistent, reliable, loving support person if you want a natural birth. For epidurals, the pros of an epidural, it is the most effective pain relief option. Many women receive complete pain relief. Also, you can get it almost any time during labor. You can't wait till you're pushing, but you can get it almost any time before pushing. It is best to wait until your labor is established, but you can get it in early labor as well. The cons for an epidural, it could slow your labor, but also sometimes epidurals are just not completely effective. Some women still feel every contraction. Some women maybe just feel pain in one spot rather than all over. You also may still feel a lot of rectal pressure when it comes to pushing. So while yes, it is the most effective pain relief option, the results vary per, woman to woman. So it's not guaranteed numbness. So that's what I have for you today. Remember, the most important thing is to know yourself, be confident in what you want, and know everybody is different. And if you need help managing the pain of your labor, then that is okay. There is no shame in that. We're all in this together.